All right. So I've got modifiers, increased procedural services. So we had, and this is another thing. Coders will sit around and go, what modifier should we use? And we have long conversations about it. It's riveting. No, no, it is interesting. But like, I remember one time we had a patient come through our surgical office, and this is super gross, so I don't need to get into it too much. Poor guy. Anyway, he had a bunch of abscesses that were super gross in a really bad area that no human being would want, especially a male, okay? But, so the doctor had to go in and not only cut him out, but there was like infection up in there, and he had to dig way up, and he had to do all this stuff, right? Yeah, it was gross. Poor guy did not sit down for a while. But anyway, so the doctor did all this stuff, so the coder for that practice, the practice is part of the hospital, right? And I've known her for a million years. She calls me and she's like, well, you look at this chart because there is, I don't even know what to code for this. There's not a code for it. You know what I'm saying? Not really. And so we looked at it and we found like the closest code, it was like removal of an abscess, like in the, with an IND and stuff, but it was just like one abscess. This guy had like 10.
Oh.
You know what I mean? So we looked at it and was like, okay, and we both agreed because, we looked at it and we were like, okay, well, let's use that code for the abscess and the IND, but we'll throw on a 22 for increased procedural service. And we'll charge more. And we'll see what happens. We'll throw it out in the wind and see what we get back. Okay? Unusual anesthesia. Maybe I have a child who is autistic and is getting their teeth cleaned. Most kids wouldn't need anesthesia to get their teeth cleaned, but some do. You put that on there. 25 modifiers, a big one. Significant, separately identifiable evaluation and management service by the same physician or other qualified healthcare professional on the same day with procedure or other service. Jeez Louise. Okay, so that's a commonly used one. So evaluation and management services we're going to talk about. Hopefully, we'll at least get the gist of it. Evaluation and management services are your exams, basically. This is the doctor examining you and making a decision about you. Okay? What that means is I had 2 of those kind of services on the same day. Here's an example. A preventive medicine service, getting your yearly physical, is an evaluation and management service. Okay? I go in, and I'm getting my yearly physical. I'm going to throw my husband under the bus here because he did this, and he knows better because before I send him to the doctor, I tell him what not to say and what to say. Because they're going to code it wrong if you say something. So here's what happened. He went in for his yearly physical, right? Of course, I didn't find this out till later. So he went in for his yearly physical. You're not supposed to have a copay for a physical, right? Because it's against the Affordable Care Act. All these preventive services are included as part of Obamacare, the Affordable Care Act, right? And you're not supposed to have any out-of-pocket expenses for those. So he comes back later and he's like, I had a $40 copay. I'm like, why'd you have a $40 copay on your physical? Right? So I call. Well, here's what happened. Is he went in for his yearly physical, and while he was there, he's like, oh, my gout's bothering me. And I need a refill on my gout medication. Well, all of a sudden, he had a problem-oriented visit, didn't he? He had a physical, and he had a problem-oriented visit. Well, you can charge a copay for a regular office visit, right? So what they did was they billed for the preventive medicine service. Oh, I chewed him out too.
Okay.
And I used it was in one of our hospital's practices. I used this is Jennifer from compliance. I'd like to talk to you about my husband's bill. I really did. So I got my $40 back because I was mad. All right. So they charged for the preventive service, right? He mentioned a problem, so then they did an office visit. I've got 2 E&Ms, right? They put a 25 modifier on it. So when whoever we had for insurance, United Healthcare or whatever, got that, they were like, okay, these were separate by the same physician on the same day. But I was like, I told him, I said, you need to go down to Hims and sign, I'm gonna read that record. I was not very happy about it. I was like, all he said was he wanted more gout pills. I don't think that's worth $40. Ridiculous. Multiple procedures, discontinued procedure, they have to stop surgery in the middle. Okay, so you see what I'm saying? Something weird is happening. Something's different than what the description of the code says, so I slap a modifier on it. Append a modifier. Don't slap it on there. Append it. Slap. 2 surgeons, surgical team, unplanned return to the operating room, assistant surgeon. You get the idea. Bilateral procedure. So maybe, because you got to watch, like a lot of eye codes are unilateral, right? They just do it on one eye. So if I say it's some kind of, maybe they're removing my eyeball, but they're removing them both, okay? So the code says 1 eyeball removal, right? But I got 2 eyeballs, okay? So I'm going to use the code for the 1 eyeball with the bilateral procedure modifier, and now they know it's 2 eyeballs, and they should pay me accordingly. Bilateral mirror image. Okay? So you've got codes that also say requires more specificity, so you've got LT and RT for left and right. Yeah. Okay, that's just more, so I've got, this done, or maybe a strap on my leg. You can put on LT for left leg. Okay? The best way I can kind of help you know when to use a modifier. I mean, if you're using Practicode, there's a little box for it, right?
Right.
Okay, so that now I better dig through this and see if what's weird is going on. The best way to know when to put one on is to just really just kind of familiarize yourself with what they are. Read through Appendix A, read through those descriptions of them, and you're like, bilateral, ding, ding, ding. Okay. The surgeon left. Ding, ding, ding. Did we have to discontinue the procedure? There's a modifier. Okay. Yeah, that'd probably I think there's So, there's also, you see those anesthesia physical status modifiers. We'll talk about this really, really quick because time's ticking fast on this.
It's 1:39.
I know. Dang. All my friends are like messaging me. They're like, "Are you coming to watch KU game?" I'm like, "No, not today. You're just gonna have to win without me." All right. So, like I said, there's a cheat sheet here, but the full descriptions are in Appendix A. Okay, it's just like, and that might be something you tab off too. Okay, you don't need to put tabs probably on all the appendices.